Senate Democrats introduce a health care affordability bill, not just concepts, but a real plan. Chris Graham here, Augusta Free Press. So Donald Trump's still working on the concepts of a health care plan. Meanwhile, Senate Democrats, who are now in the minority in the senior chamber of Congress, have a plan in place. The question is, can they get Republicans to sign on? Probably not, but it's definitely worth discussing. You never know, right? The Health Care Affordability Act, introduced last week, would lower healthcare costs for millions of Americans and make permanent the current enhanced premium tax credits for health insurance marketplace coverage. Now, those premium tax credits were created in the Affordable Care Act and enhanced under the American Rescue Plan Act and the Inflation Reduction Act. That's a lot of acts. The problem is they're set up to expire at the end of this year, at the end of 2025. And that would increase health insurance costs for more than 20 million Americans. Now, this Healthcare Affordability Act would make the enhanced premium tax credits permanent, ensuring that people who qualify for them don't face sudden cost increases or be left without coverage at all. Without an extension, out-of-pocket premium payments across Virginia would be projected to increase as much as 33%. That's according to the Virginia State Corporation Commission. Now, here's a joint statement from U.S. Senators Tim Kaine and Mark Warner on this legislation. For years, the Affordable Care Act premium tax credits have lowered healthcare costs and increased access to insurance for Virginians and their families. Through the American Rescue Plan Act and the Inflation Reduction Act, we further lowered costs for American families, but without action, these enhanced tax credits will expire. We are proud to introduce this legislation that will ensure more than 20 million Americans don't face unfair cost increases at the end of the year. Seems pretty cut and dry. Again, it's going to be tough to get Republicans to sign on.